My name is Bill Peine. I work at Medtronic. I lead the research and technology group within our surgical business. There's a lot of innovation that's happening within Medtronic. We're the largest health technology company in the world. We have over 95,000 employees, and we treat over 70 conditions in the heart, in the brain, in the abdominal space, all over the body. And I think an area that we're really excited about and pushing on are two things. One is robotics, and then the other is AI. And it's really about using these technologies to make procedures more precise, more predictable, and more intelligent, right? And so precision is about being able to reach the operative site in the least invasive way possible. As a patient, you want to be treated, but then you want to get back to your normal life as soon as possible. And I think this robotics and miniaturization of devices is pushing that boundary and making it even more possible. And then the predictability piece, that's really about using the power of AI to help make procedures more consistent and avoid complications. That's one of the most costly parts of our healthcare system is when something doesn't go as expected. That's not what the patient wants, it's not what the physician wants, and certainly it induces a lot of costs. And then the last piece is really that intelligence, right? And that really is, maybe a better way to describe it is driving toward democratizing surgery, making it so that or not just surgery, it's also delivery of therapies across the entire body, right? Being able to put in a heart valve or a pacemaker. But you want to make it so that when you do these procedures, you get the same positive result every single time, no matter which physician you go to, no matter which location it's performed at. And again, this is where the combination of robotics and AI, it simplifies the usability of these devices. It makes it much more consistent and more predictable and precise, all three. One thing we're seeing is changing the way surgery is performed. And there's many aspects of that. As I mentioned in the last answer, making it less invasive is important. So this is where you're starting to see the development of endoluminal applications. So rather than making a large incision into the body, sort of going from the outside in, what if you could make a device that could follow the natural pathways in the body that already exist? Being able to go through the mouth and get into the lungs, for example, through the airways, or down the mouth and into the digestive tract, or follow vasculature. So being able to enter an artery or a vein and then navigate up and be able to be in the heart or the brain. You can reach pretty much every organ of the body using a natural pathway. And these types of approaches are again, less invasive. So I think this is a trend you're seeing in therapy delivery, is more and more devices that can be deployed in this way. I think another major trend that you're seeing is changing the location of where surgery is performed. Oftentimes, you would go to a major hospital, downtown hospital, a teaching hospital. Well, they have a limited number of beds. Oftentimes it's expensive at these locations. It's hard for patients to always reach these places. We need to move procedures, again, using democratization approach, be able to take that same level of care and be able to perform that at a satellite hospital or an ambulatory surgery center or at a doctor's office. This means you just need to make these procedures, again, less invasive, easier to perform. You need to be consistent. And as you start to move procedures, to spread them around, it allows for, again, more access. It's about providing, and also lowering costs, right? I think both of these things are really important drivers. We're just scratching the surface of what you can do with these robotic technologies and AI and digitization and information age. So there's a lot to be done still. I think we're only at the beginning, and it really is a tipping point of being able to transform healthcare in a significant way. My advice would be understand where things are headed, right? It's like in the world of hockey, they say skate to where the puck is going, not where it is today. I think that's very important. You have to see where are the trends. How can we transform as things move to these other locations, as they become less invasive? If you're in the surgical space, solve those problems for the future. Bring technologies, bring additional AI capabilities and new sensor technologies. All that could be focused on 5, 10, 15 years down the road. If you try and solve just what's today, I think you'll be behind. I think another bit of advice I would say is to really go after the hard problems, right? Be able to do something that is a huge unmet clinical need, but really impacts patients' lives. If you start with a patient, then most of the other things will flow. Find something that's a major problem for a large population of patients, and then find a unique solution that helps dramatically improve the outcomes of these procedures. I think that is where you'll see true innovation deliver results for patients, and then that leads to the financial benefits of a startup as an entrepreneur.